The topic I will be discussing is bronchoalveolar lavage, or the BAL technique. Why is this technique used? This is used to determine if there is any inflammation in the lower lung field and what type of inflammation is present. This will be done when a lower airway disease is determined, such as HEAVES or IAD, which is inflammatory airway disease. This can also be used when interstitial pneumonia, fungal pneumonia, or celiacosis is suspected. This technique gets a sample from even farther down in the airway than a transtracheal wash, but most of the time BAL only gets a sample from one lung field, so you could possibly not be in the diseased lung field. What supplies are needed? Sedation is always needed, and such as xylazine and butorphanol. This is what the one study that I read used. You can use a twitch if needed, an equine BAL catheter with a 3-way stopcock, or a endoscope, a 6 ml syringe to inflate the cuff at the distal end of the catheter, 1 20 ml and 3 60 ml syringes for lavage, 150 milliliters of 0.9% saline at room temperature or slightly warmed, 2 red top vacutainers. Each are going to be filled halfway with 50% ethanol solution for sample preservation. How to prepare for this procedure. You're going to first sedate the horse, then you're going to check the catheter, the BAL catheter, cuff by inflating it with 5 mLs of air, completely deflate the cuff before inserting the catheter into the horse. You're going to then draw up your sterile saline into your 20 ml and 60 ml syringes. You're going to then apply the twitch to the horse before you start if this is needed. For your procedure, you're going to first clean the horse's nostril to make sure there isn't any mucus or anything blocking the path. Then you're going to apply a sterile lubricant or water to the cuffed end of the catheter to allow it to go smoother. And then you're going to apply the twitch to the horse for more restraint if you decide to choose this. You're going to then pass the BAL catheter into the ventral nasal meatus and put your thumb over the nostril so that it stabilizes the catheter and goes down smoother. And you're going to advance this toward the larynx and have your strainer extend the horse's neck so that the catheter can pass through the glottis easier. You'll then advance the catheter down the trachea until resistance is felt, and you're going to try to pass this smoothly and quickly to minimize coughing. Once you have felt the resistance, the catheter is in the correct position, you're going to ask the restrainer to place their thumb where your thumb was and place it against the nasal septum to keep in the catheter in the correct position still. You can then inflate the BAL catheter cuff with the 5 mLs of air and attach the 20 ml syringe to the stopcock. You're going to open up the valve and steadily infuse the saline into the catheter. This is going to fill the dead space. Then you can detach that syringe and then attach the 50 ml syringe, 60 ml syringe, and infuse the whole syringe of saline down the catheter. You're going to then take that one off and attach the next 60 ml syringe and repeat this process until 150 mLs have been administered down the catheter. You're going to then immediately, after all the syringes have been administered, start to aspirate the saline back into the syringe, and then you can open the stopcock to expel the air out of the syringe and then continue to aspirate, and then you're going to keep adding more syringes onto your stopcock until you get no more fluid back from the horse, and then the rest of the fluid the horse will absorb. After you have gotten all of your samples back, you should have gotten at least 30 to 50 mLs per each syringe that you have administered. The fluid should look turbid or frothy, and you know that that is the correct sample that you have. You don't just have the fluid from the dead space that you administered into the catheter. And when you have this, you can deflate the catheter cuff so you know that you're okay to take the catheter out now. And you're going to just pull it out smoothly, take off the twitch if you use this, and allow the horse to come out of their sedation before moving them. You're then going to put the fluid that you collected in a cup to mix up the samples to make sure that it is a full rounded sample from every part of the horse's bronchioles. And then you're going to put 5 mLs of fluid into each vacutainer tube, which already has the ethanol in it. You can then submit these samples to a cytologist for examination of the fluid to see what type of inflammation is present in the horse. I have a picture here of a BAL procedure being done on the horse, so you can see that they are holding the catheter or the endoscope in the proper position, the restrainer is, and then they are using the endoscope to see they have the camera and they're actually seeing on their monitor what the bronchioles and the airway is looking like. And you can see the one doctor in here has the saline attached to the catheter endoscope and he's looks like pulling back, or maybe he's giving the fluid, but they're seeing what they're doing. So this is what it would look like if one was actually done. And here are some cytology findings. So on the left picture, there is a horse with asthmatic and non-asthmatic horse. So you can see the difference between the amount of cells on the asthmatic horse compared to the non-asthmatic. And you can also tell the inflammation status of the non-asthmatic horse. It's pretty clear airway, it's not inflamed at all. And the asthmatic horse, you can tell there's a lot more inflammation in the bronchioles. And on my right picture, I have the samples. It shows the numbers of the percent of neutrophils that a normal horse will have. So a normal horse should have less than 5% neutrophils, and a horse with the heaves would have greater than 20% neutrophils. So that's what would come back from the cytologist. And here are my sources.